More than 340,000 people are estimated to be living with dementia in Australia in 2015. And this number is projected to reach more than 890,000 by 2050. The general practitioner is usually the first contact when concerns about thinking or memory arise, which means you hold a unique and critical role in dementia detection, diagnosis and ongoing management and care. Unfortunately, diagnostic rates nationally and internationally are still low. Evidence shows that currently at least half of the people with cognitive impairment presenting to their GPs do not receive a diagnosis. And for those people who do receive a diagnosis, it takes an average of 3 years from symptom onset. A timely diagnosis of dementia may enable patients and their families to plan ahead and instigate practices that could reduce cognitive impairment and slow symptom progression. Detecting possible cognitive impairment is the first step in determining whether or not a patient needs further evaluation by a specialist medical team. Dementia is not a normal part of ageing. It's an umbrella term for a number of neurocognitive conditions, of which the major symptom is a serious global decline in brain function. The latest diagnostic criteria, the Diagnostic and Statistical Manual for Mental Disorders, or DSM-5, classifies the neurocognitive disorders, or NCD for short, as either major, which includes dementia, or minor. There are over 100 diseases that may cause dementia. The most common and well-known of the dementias is Alzheimer's disease. Other forms of dementia include dementia with Lewy bodies, vascular dementia, and frontotemporal dementia. There are different symptom profiles that are associated with each of the different forms of dementia, and they vary from person to person. Mood, behaviour, and personality may also be affected. Some of the common signs and symptoms, or red flags, include memory loss that affects day-to-day function, forgetting recent events, increasing confusion, reduced concentration, difficulty performing familiar daily tasks, disorientation with time and place, problems with language, problems with abstract thinking, poor or decreased judgment, problems with spatial skills, misplacing things, loss of initiative, apathy, withdrawal or depression, and changes in mood, personality or behaviour. In the majority of cases, dementia has a gradual onset, is progressive in nature and is irreversible. It's important to remember that dementia does not start when the patient can no longer live independently, and neither should diagnosis and treatment. Dementia starts with cognitive decline and/or personality and behaviour changes that impact on daily function. Timely recognition of dementia requires GPs and practice nurses to be aware of and to recognise the signs and symptoms in their patients. Signs of possible dementia should be taken seriously. A timely early diagnosis can provide many benefits for the patient and family and allows planning for their future. If a patient or carer reports cognitive impairment or deterioration, or if you directly observe signs yourself, you should assess cognitive function using a reliable screening tool, such as the GP Cog test. Also consider assessing a person who reports falls or balance issues, or where there are unexplained deteriorations of a chronic disease. Routine 75+ health checks and the activities of daily living scale offer further opportunities to screen for dementia. And be aware that while rare, dementia can affect people in their 30s, 40s and 50s. There are an estimated 25,000 people in Australia with younger onset dementia, which is a diagnosis of dementia under the age of 65. Cognitive screening in general practice is designed to determine the need for further evaluation by a specialist such as a geriatrician, psychiatrist, neurologist, neuropsychologist and/or a memory clinic. More information about screening tools and referrals can be found in our video series and on our website. Your role as a GP or practice nurse in dementia diagnosis and care is critical. By facilitating the early detection of dementia and initiating further diagnostic assistance from a specialist, you can help your patients, their families and carers to achieve better health outcomes and a better quality of life. To learn more, go to fightdementia.com.au. dementia.org.au/support and services/health professionals.